Hello and welcome to this special feature. Now, India's healthcare sector has seen a profound expansion. There has been a significant progress in refractive surgeries and there has been an onset of many innovative technologies. This holds out hope for millions of Indians suffering from various visual impairments. To talk more about that, I have with me a highly accomplished ophthalmologist of the country, someone who specializes in refractive surgeries, cornea and cataract, none other than the Director of Medical Sciences for Centre for Sight Group of Eye Hospitals, Dr. Ritika Sachdev. A very warm welcome to you, Dr. Ritika.
Thank you.
I would like to begin by asking you, Dr. Ritika, that if I wear spectacles, the idea of being able to get rid of them is extremely alluring. How can the technology that we have today help me in forever get rid of spectacles?
So refractive surgery or getting rid of spectacles is one of the most popular cosmetic procedures across the world. So in India, I think the awareness for refractive surgery is less, but the technology is available across the country, and with a laser procedure that lasts only a couple of minutes, you can today get rid of your glasses. Refractive surgery, when done on people, and those people were asked many years later that did you make the right choice? If given a chance, would you get this thing done again? 95% people said yes. So I think that is testimony that it is really a life-changing surgery. The only two things that are preventing people from getting this done is that sometimes there is lack of awareness. They believe that there are other ways to get rid of spectacles, some eye exercises, some home remedies, but there is none. You need to get laser vision correction done. The second is that you have to choose the right doctor and the right procedure to get the best results. So I think there is no need to fear, but there definitely needs to be some information access and a choice of the right place, and you will get near perfect results.
Right. So someone who's watching us, who's actually contemplating getting it done, refractive surgery, as we say, now how intensive is this surgery part of it?
So see, as doctors, we like to call everything surgery because whenever you do anything to any part of the body, which is other than putting medicines, it is a surgical intervention. But this procedure can actually sometimes be done even without a doctor touching the eye, with only a laser reshaping the cornea, which is the front part of the eye, in order to remove your spectacles, and the laser firing only for a few seconds. So theoretically, it is a laser procedure which lasts a few minutes, but the medical jargon of surgery may sometimes feel a little frightening for patients. Let me just explain that this is the front part of the eye or the cornea. You know what's visible to you. You sometimes even put a contact lens over this cornea. Now, the fact that you need to wear glasses or contact lens means that you need to change the power of your eye.
Absolutely.
Right? So you're doing that either by wearing spectacles or by putting a lens over your cornea. What we are doing in a refractive procedure is simply using a laser to reshape your cornea. Now the laser fires within a micron. Now micron is 1,000th of a millimeter. So when you look at a scale, that is, you can't even possibly plot that, right? It is so fine. Right. So that laser is making such fine cuts in your cornea in order to reshape it. And when we reshape the cornea, so it's like having an invisible spectacle or a contact lens embedded in your cornea. So that reshaping the cornea gives you the permanent vision correction. Right. And because earlier, say about 30-40 years ago, the urge for doctors and patients to get rid of spectacles was always there. So the surgery started using a diamond knife, which was held by a hand. And the doctor used to make cuts to reshape the cornea. Now, obviously, because it's a knife and held by a hand, the results were a little unpredictable. But that was nearly 40 years ago. Things have evolved rapidly. The laser has a lot of software-guided artificial intelligence, so as to say, that it is able to demonstrate perfect results because now we have normograms and lasers that precisely fire in order to carve out a lenticule or basically reshape the cornea in a manner that the spectacle or the contact lens that you have to be dependent on gets embedded or imprinted within the cornea itself.
Right. So someone who's watching this and is getting more attracted to the idea of actually taking the plunge, how much of a downtime should I keep to walk into a center for sight, get myself checked up and walk out with this permanent correction?
So we basically require only a couple of minutes to do the procedure, but what is more important is to have a complete checkup of the eye to see if your eye is healthy enough to take on the procedure. So there are some eligibility criteria. First, you can actually tick them off mentally. You must be above the age of 18. Your power should be stable for at least 6 months, because if your power is changing rapidly, that is not the time where you go for a permanent correction. You should first have a stable power, which normally does happen between the age of 18 to 20. In pregnancy and lactation, this procedure is not advisable. So if you're an adult with a stable refractive power, you should seek out a doctor's appointment. What a doctor will do is simply map the shape of your cornea, and in 95% cases, the cornea in terms of shape, structure and thickness has the strength to take on this procedure. It is a very few percentage of patients who may have an underlying disease called keratoconus who need to be excluded from this procedure.
Sure.
So we do a lot of tests which are fast enough, but because of these advanced machines, we actually create a 3D reconstruction of the cornea, both in terms of shape, thickness, and now with newer devices, even the strength of the cornea. So this, like I said, the outer coating of the eye is the cornea. And because we work on the cornea, if the tests show that your cornea is strong enough to take on the procedure, you are eligible for the procedure. Once the test is done, we gather some measurements which are then fed into the laser, and the laser procedure, so the time that you spend in the OT is a couple of minutes. You are at most walking in, walking out 15 minutes to 30 minutes, depending on how nervous the patient sometimes is.
Right.
But the laser itself is in seconds. So the procedure in minutes, the laser in seconds, and the recovery within a couple of days. So if you walk into a doctor's office on Friday, you can get your self-tested and screened, schedule your surgery for Saturday, take a single day's rest and be back to work on Monday. So it's really a weekend getaway.
Wow. And tell me something, you spoke about, of course, the other eligibility criteria, but if I'm someone who's got very high power, can this actually help fix my vision?
So the cornea that we work on has certain limits to it because you can't alter a natural structure infinitely. So in case you have a power up to -8 and sometimes up to -10, the cornea, because it is the outermost part, is easily accessible, we work on reshaping that. But if you have a higher power, say above -10 or a high plus power, then instead of working on the cornea, there is a natural lens inside the eye and there is an artificial lens that is available by the name of a phakic IOL. We simply implant that through a 2 mm incision. So it's like instead of wearing contact lenses over your eye, you have a lens implanted inside the eye, and that procedure again is only a couple of minutes. So we have solutions up to -30 also. But depending on the range of correction that you need, if it's up to -8, -10, you can go for laser-based cornea procedures like LASIK, Contura, Smile, or Silk. But for higher powers, possibility of correction with a phakic IOL, sometimes known as ICL or IPCL, is there with near perfect results.
Let me take this further by asking you, Doctor, you've been in this field for years now. How have you seen the refractive technology evolve over the last few years?
So I think refractive technology has evolved tremendously over the last few decades. Like I said, first we were using a knife like maybe 40 years ago. That era is completely over. We have now moved to the use of lasers. Now, when it comes to laser refractive surgery, we must understand that for anything to be permanent, it has to be done in the part of the cornea which is inert, because it should not respond back and reverse the change. I often give my patients an example that you sometimes have those paste-on tattoos, right? You paste it on your skin and then you wash your hands and that's gone. But when you have to really get a tattoo, it has to be embedded. The pigment has to be embedded a little deeper. because the deeper the pigment, the response in terms of the healing back is not there, and it stays in a place where the change is permanent. Right? So what we do for laser refractive surgery is that we reshape the cornea. The cornea is the front focusing part of the eye. So like you need to wear spectacles, you need to create a change of equivalent to the spectacle power in the cornea. In order to create a permanent change, you have to make this change in the deeper part of the cornea. So the technology has evolved in a manner of how to access this middle part of the cornea, which we call the stroma. The first procedure that is very popularly addressed to as LASIK today requires a flap to be lifted in the cornea. Now, once this flap is lifted, you automatically have access to deeper tissue. Here, the excimer laser acts and within a matter of seconds reshapes this tissue. The amount of reshaping that is done depends on the spectacle power that you wear. And this flap is simply put back on. The cornea stroma naturally attracts the flap back into position and it holds it back into position. The only flip side is that this flap is a cut that with significant trauma it can dislodge, and it is a slight defect that remains with you forever. Under normal circumstances there is no issue with that, but still there can be a better way to do refractive surgery, and that came to the forefront nearly a decade ago with the technology called SMILE. And the latest advance on this technology is now the upgraded version called SILK. What we do in a SMILE or a SILK procedure is that instead of it being flap-based, we call it lenticule-based. We are now using a different laser, a more advanced laser. In LASIK, while we use the excimer laser, in SMILE or SILK or lenticule-based surgeries, we use a femtosecond laser. A femtosecond laser has the ability to cut beneath the surface without the surface needing to be exposed. So what it does is, it basically doesn't require you to create a large flap to give it access to the cornea. It is able to work within the cornea without the cornea being exposed. So it basically carves out the lens that you need to remove. Right? Because if you remove tissue, you reshape the cornea. You can't add natural tissue like you add a spectacle or a contact lens, but you can remove the opposite of that shape to reshape the cornea. Right? So we are creating a shape in the cornea that when it is removed, the cornea is reshaped. The lenticule that is carved, like suppose the femtosecond laser is going to act beneath the surface without the cornea or the eye being opened up. Right? And then you simply make a very tiny 2 mm incision, which is 2 millimeter is something like 2 or 3 hair thickness. And then simply through that tiny incision, you remove the lenticule that the laser has carved out. And that is it. And because this incision is so tiny that it is covered by the lid, you can't even see it well the next day. And sometimes doctors that see a patient, even eye doctors, can't really tell on a general eye examination that the surgery has ever been performed. So this lenticule extraction procedure makes the surgery much more stable, precise. There is no danger of any defect remaining in the eye. And because you're not cutting much, the downtime in terms of getting some degree of dryness or taking some degree of extra care, like you can't go for a swim, etc. So sometimes when a patient gets a lenticule extraction surgery, we tell them that even if we don't see you after a couple of days for the rest of your life and you want to actually box with an opponent in a boxing match, that is the strength that we impart in terms of not taking away strength and giving you natural vision and a cornea which has natural strength enough to withstand any trauma.
If I'm someone who aspires to be in defense forces, can refractive technology help me looking at what my further life's going to be?
Absolutely. I think this is one of the big boon that sometimes patients tell us, that you've actually allowed us to live our dreams. So refractive surgery within certain limits of eligibility criteria laid down by the government can be done for candidates. The candidate should be above the age of 20 and the power that you can correct has to be less than -6. So if your power is very high, then refractive surgery, even if you get it done and if your vision is fine, but because you've gotten a higher power corrected, you may be disqualified. What causes a power to be high is that your eyeball is larger, right? So like you measure the power, you can measure the size of the eyeball also. So if it is more than 25.5 mm, you cannot apply for the army. 25.5 is actually the Navy and the Air Force, and 26 is the Army and Police. So roughly, if you are less than 25.5 mm in terms of eyeball size, which can easily be measured by your doctor, your power that is corrected is less than -6 diopters, you will be a safe candidate for getting it done and still getting enrolled. After the refractive surgery is done, sometimes people say that the outcome may still, if you have a 0.5 power left behind, you still don't need to worry because the army will still enroll you if your power is within ±1 diopter. However, the cornea, we work on the cornea to reshape it. The cornea becomes thinner because whenever we're going to reshape something, we're going to remove tissue. A normal cornea is between 550 to 500 microns. So after the surgery, your corneal thickness should be more than 450 microns. So these are the basic criteria, but your doctor will be able to tell you pre-operatively if you check off these criteria. Broadly, what you should know is, yes, refractive surgery makes it safe and makes it possible for you to enter the armed forces, provided your power correction is less than -6 diopters and you get it done after the age of 20 years.
Sure. I'm sure, Dr. Ritika, you see this every day, that we as patients, before we come in for any procedure, we have a tendency to go on the net and search about it and end up getting confused. Could you please lay it down crisply and correctly for us about what is refractive surgery all about?
So I think, there's a science behind refractive surgery and we use various lasers, but these lasers have to be manufactured by companies. And each time a company manufactures a device, they give it a name. So the same procedure gets multiple names because multiple companies manufacture it. And therefore, this leads to a lot of jargon, which is a little unscientific and more industry-driven. For example, the LASIK procedure, which was the most popular procedure for refractive correction, was augmented in terms of the laser delivery speed and the software that was used to measure the eye. Each time an upgrade comes, the name change is not as simple as iPhone 11, 12, 13, 14. We keep it more complex. So some company may call it Contura, others may call it ZY optics, some people called it custom view. So these were customized ways to do LASIK, but everybody was doing the same thing with a different name. Of course, some got better content on the internet, so the patient found that procedure to be more popular. But all the companies were upgrading to a similar technology to give similar results. However, what has happened now is that from LASIK or Contura or iLASIK or custom view or ZY optics, which is one generation of refractive surgery, we have moved to the next generation, which is a fundamental advancement in the fact that you no longer need a flap. A flap, once created, gives your eye an inherent defect that stays with you for life in terms of a slight weakness in terms of the strength of the eye. The new generation of procedures are lenticule-based procedures. This was started by Smile nearly a decade ago. Now these lasers have become faster and they cut more smoothly because the laser spot becomes smaller, the cut becomes finer, the results become better. So what started with Smile as a fundamental advancement a decade ago now is being carried forward by companies, and the latest advancement in this lenticule-based procedure is the launch of Silk. Silk does a similar lenticule correction, the differences being that the lenticule is shaped better, possibly cut better, and in a faster laser, that the focusing speed accuracy and the rate of firing of the laser is better. So the procedure is getting advanced. The lenticule-based procedures are the future and actually the present as well. What started with Smile is today available as Silk and as Clear. These are not really names, they're all acronyms. And if you break down the acronyms, they're all scientifically talking about the same thing.
Okay.
But when you go on Dr. Google, the content is basically manufactured for the patient. And sometimes in order to simplify things,
right,
you oversimplify it in a manner that you cannot give a life-changing decision and full advice in 2 minutes, which is what you get of an Insta reel. So it needs to be deeper, and I would request that you speak to your doctor. That a lot of this jargon is actually very simple when you break it down scientifically. However, I would say that sometimes a doctor, when he invests in one technology, has greater experience in that technology and continues to market that technology or offer that technology to the patient. We at Center for Sight, because of our large network, have had the proud privilege to actually do the first ZY Optics customized LASIK. One of the first in India was done here. The first femtosecond LASIK, eye LASIK was in Asia, was installed with us. We had the privilege of doing the first Smile in the world, the single incision Smile at Center for Sight Baroda. And the first Silk procedure in a human eye was done at Center for Sight Delhi. So as the procedures advanced, we feel that one size does not fit all, and you need to basically cater technology to the perfect fit for the patient.
So has it ever happened with you, Dr. Ritika, that a patient walks in and says, I need to get this procedure done and I've researched about it, doctor?
Yes.
But when you actually sit and do their checkups and see their needs, you recommend them something entirely different?
It often does happen. I had one of my patients who was a university student in the United States of America, and US-based technologies are marketed more in United States.
Right.
So when I asked him, what are your hobbies? He said, I'm in the rugby team of my university. And he had heard about Contoura LASIK because it being developed in the United States was very popular there. And he insisted on getting that done. But when you're a rugby player, you are more predisposed to blunt trauma or physical trauma. And a lenticule-based procedure like Smile, which at that time was very popular in Asia and Europe, but hadn't reached the United States, was the natural choice for him, because you want a stronger cornea. You're actually exposing yourself and throwing yourself in a rugby field. So we actually gave him the information. The choice eventually remains with the patient, and he spoke to his ophthalmologist in the United States. Because Smile wasn't launched there, the doctor was very skeptical, but then he spoke to enough of his Indian friends and undertook the decision to take Smile, and we did give him enough information to support his decision, but it took a rather longish time, which should have been a straightforward selection. So sometimes Google clutters our mind and we have to first declutter it in order to give the right option to the patient. We also have a patient who sometimes have high cylindrical power, and they have friends who've gotten Smile done. Now, Smile is the best procedure for minus power, which is 80% of the people. But a high cylindrical power requires some degree of personalized treatment in terms of an irregular cornea is better corrected with contour-based procedures like Contoura, right? So that patient, because his sister had actually undergone Smile, insisted on Smile, but he had a cylindrical power and was a perfect candidate for Contoura LASIK. So that is where one size definitely doesn't fit all, and you should declutter the mind in terms of a fixation on a procedure and let your doctor give you the best advice.
Thank you so much, Dr. Ritika, for sifting through so much clutter that we hear on net and we read on net, and making us actually understand what refractive technology is, how the journey has been, and what all the possibilities lie ahead in future. Thank you so much for sharing such valuable insights.
Thank you. Thank you.
And now, of course, we understand from this that the future of refractive technologies in India is promising. We hope that coming in of more and more of innovative techniques in this field can actually help us shape the future vision of India. Thank you for watching.